this presentation more detailed thing.
Absolutely.
But sorry, we are running out of time. Ekta, may I ask you to go ahead with your presentation? Dr. Ekta was a vitreoretinal surgeon at Shankar Netralaya, and now she is a instructor in charge of electrophysiology at Nebraska, University of Nebraska. And I welcome Ekta to give this talk.
Thank you, Dr. Sumita and AIOS. Can you see my screen?
Yes. May I ask you to wrap it up as soon as possible?
Yes, please. So I'm just quickly going to a patient this is a teenage boy who was referred with some mottling of the retina, and basically on the OCT, the referral physician found some cystic spaces on the OCT. Now, once we did the detailed electrophysiology, we found that the photopic as well as scotopic responses were significantly reduced, and there was a negative B wave on the ERG. Even a more detailed testing of pattern ERG and photopic negative responses were reduced. So this patient ultimately had mucopolysaccharidosis type 3, that is a Sanfilippo syndrome. So this was just to illustrate the wide battery of tests which are now available. And electrooculogram looks at the retinal pigment epithelium. We do ERG and MFERG, which is looking at more of the inner retina. But now what we have is more of pattern ERG and PHNR, which is photopic negative response, which can even look at the ganglion cells. For the children, ICIF has given 5 protocols, and it's important for children to have fixation, to have multifocal ERG, pattern ERG, and electrooculogram. And there is a newer protocol called GOSH protocol, which is with a reduced timing, just 5 minutes of dark adaptation, which is now being tested in children, and it has found to have equivalent result to ICIF standard protocol. And this is being employed in many European countries. So what we know about the development of ERG is like the light adapted responses, they are the first to mature, but the dark adapted responses take almost 10 years to reach the adult size. Electrooculogram, we all know about the Ardens ratio. So we have gone much beyond the vitelliform degeneration, and now we have its application in acquired diseases like azure, quinine toxicity, and birdshot chorioretinopathy. So the Ardens ratio is basically reduced. This is another patient with autosomal dominant vitelliform degeneration where the Ardens ratio is reduced, and it proved to be genetically best one mutation. When we come to full field ERG, going beyond the normal A and B wave, which tests the first order neuron, that is the photoreceptor and the bipolar cell. The interest is into now the inner retina, which is the ganglion cell. And for that, we need a pattern ERG or a photopic negative response. So for the kids, it's important to have a dark adapted intense flash. That is, we need more brighter flashes. And this has some more usability in children. Another type of dark adapted response, which is a red flash, is very important as it also gives us a function of cones, which comes in the form of an X wave, and then the B wave, which is a rod response. So this is important to diagnose cone dystrophies and achromatopsia. And it has a very important use in vitamin A deficiency, where the rods are first gone, but the X wave is still retained. Electronegative B wave is basically B by A ratio less than 1. And this is one of the patient where you can see at the macula some cystic spaces seen. This is on the OCT. And if you look at the ERG, there is a reduction in the dark responses, the scotopic responses, but the B by A wave ratio is 0.97, which is less than 1. So this is X-linked retinoschisis. Another vitamin A deficiency patient. Again, there is almost extinguished B wave. This is a patient with the corneal clouding in the left eye. You can see the fundus image is not well seen. There is some pigmentary change, which is non-specifically seen on the retina, and with some scetic spaces on the retina. But if you look it on ultrasound, there is a thickened choroid sclera junction and the widened optic nerve. So this patient had so much of visual field loss. The patient had electronegative B wave. So this forced us to do further testing. And this patient was found to have a mucopolysaccharidosis type 1, which is a Hurler-Scheie syndrome. So when we are talking about B wave, negative B wave, it's also important to know the importance of on and off bipolar cells, because in a complete congenital stationary night blindness, only the on pathway is gone. But in an incomplete pathway, both on and off bipolar cells, they are dysfunctional. So how do we test that? So this is a newer protocol for topic on-off ERG, which can detect the B wave and the D wave. The B wave is for the on bipolar responses and D wave is for the off bipolar responses. So this is one patient who had a light sensitivity from childhood. You can see a bullseye maculopathy-like lesion. The patient had a CDHR1 mutation, which is for cone rod dystrophy. And looking at the ERG, you can see extensive reduction in the photopic responses. But there is also a reduced on and off ERG response, which is because the cones are responsible, they get signals to both the on and off pathways. Another important modality is pattern ERG, which tests the central retina, which is with a pattern. And there is a P50 response and there is a negative N95 response. So this is important to differentiate a maculopathy from an optic nerve disease. So N95 reduction is prognostically responsible for the optic nerve disease, and it is a late change. If it is reduced, it does not improve. So it also can help us in functional overlays. There are small and large fields which can be tested 15-degree and 30-degree, and which can basically test, if you can see, this is a achromatopsia, which is a smaller, just central defect. And here the 15-degree, central 15-degree will be abnormal. But this is a patient with Joubert syndrome, where the periphery is abnormal, but the center is functional. So these are two protocols of pattern ERG which can be tested. This is just, it can be lost in Wolfram syndrome, which has an optic atrophy. And this is a patient with Wolfram syndrome, where there is a reduced light flicker and there is a reduced P100 amplitude and increased latency. So for the, I will be skipping them fast. And there is also an interest in transient smartphone blindness, like patient can present with a monocular vision loss with increased visualization of the smartphone, and the ERGB wave is reduced. VEPs, basically, what is new is like we have laid more stress on pattern reversal. The pattern onset, offset VEPs are important for children who have nystagmus, because not with fixation, we can do a better recording with that. Another is a sweep VEP, which can help in visual acuity assessment. So we start doing that as well. So this is a patient with optic neuritis, where you can see on pattern VEP, the P100 waveform is basically, amplitude is also reduced and it is delayed. But look at the pattern ERG, where the N95 waveform is also reduced. Another patient with autosomal dominant optic atrophy. And once you look at the pattern ERG, N95 is reduced in both the eyes. Albinism can have a misrouting of the optical chiasm, and this can be tested by a multi-channel VEP. And this is pretty useful. So I'm just skipping that. Now, this is a patient who came with no visual complaints, but had some pigmentary changes And this was found to have a USH2A mutation, which is a Usher's mutation. But this patient was found to have no auditory complaints and hearing was normal. So this was basically a extinguished ERG, which forced us to do the genetic testing. And this was a non-syndromic Usher mutation. This is a 6-year-old girl who was a carrier of albinism. The father had basically albinism.
Ekta, can you just wrap up? I think
Yes.
we have taken 15 minutes extra. Sorry that we were the last speaker.
I'm just skipping. So this patient basically had an asymmetrical VEP, which is because of the misrouting. ERG is now important in diabetics. There's another photopic negative response, which gives us some idea about the retinal ganglion cells. And there are so many publications which have come, but it is very important in early diagnosis of glaucoma. Migraine has supernormal responses. There is also interest in autism, schizophrenia, because of the neural pathways that ERG can help. Enhanced S-cone syndrome, where there is a S-cone protocol which can be done, and the S-cones are enhanced, and L and M cones are missing. Even there is an enhanced response in Huntington's disease. But COVID is something which helped us, we got so many manifestations during the last year with retinal ischemia and, outer retinal and inner retinal damage. And there was a reduced photopic and scotopic responses and extensively reduced pattern ERG and photopic negative response, which never recovered.
Dr. Ekta, I think conclusion. Thank you.
Yeah. So thank you so much.
Thank one and all, and welcome back to Shankar Netra.
Thank you.
Thanks to Dr. Sumita.